Our next speaker is Leila Vazovic, who will speak to us about OCT angiography in children.
Thank you, Phil, for introduction. Thank you to the organizing committee for the opportunity to speak to you today. These are my disclosures, and really the relevant is that Heidelberg provided the research equipment as well as grant funding. We also had funding from IGO, NIH, and RPB. I will be talking to you about developing OCTA devices for imaging pediatric patients. These are investigational devices, and all of the patients were enrolled under research protocol that was Duke IRB approved. We all know it's a challenge to examine pediatric patients in clinic. Primarily, we're used to using indirect and really getting glimpses of the posterior pole. So we have reverted to taking these patients to operating room and doing exams anesthesia. But here, we also have limited technologies available for us to examine these patients in the operating room. So we teamed up with Heidelberg to investigate this investigational device, which is this portable system. This is very similar to tabletop system, and hence it's attached to armature and can be taken anywhere, including operating room. It has capabilities of obtaining OCT, OCTA angiography, fluorescein, and ICG. And we use this in our study. We imaged 297 eyes of 178 pediatric patients. Most of these were healthy normals, but also included various diseases that were undergoing exam anesthesias. We used their standardized methods to examine the OCT as well as OCTA, and I specifically will be talking to you about superficial and deep vascular complexes. In healthy infants and children, what did we find out? When in earliest infants that we imaged, which is at 48 weeks gestational age, we found out that foveal microvasculature was fully developed. We also found out that FAZ and vessel length density very much varied according to race, most of all, central subfoveal thickness, age, and axial length. So those were very much important in figuring out as we were looking at FAZ development. And in bilateral cases, when we imaged both eyes, we found out that the eyes were very symmetric. So one can conclude in unilateral disease, unaffected eye can be used potentially as a control for FAZ as well as vessel length density. We also imaged various diseases, and here's an example of ROP baby, a 73-week-old undergoing silicone oil removal in the right eye and really getting imaging of the left eye. You'll notice the foveal vascular zone is very abnormal appearing, and also we have these superficial vessels that are really diving down in a deep vascular complex, as you can see pointing out here with red arrows. One may think this is a segmentation or projection artifact, but no, as you look at the segmentation to the right, you'll notice that very much is diving down deep into a deep vascular complex. One can also see this in foveal hypoplasia, such as albinism. And we may see these kiddos with lower visual acuities in clinics and not really understand that these are foveal hypoplasias, as well as really not developed foveal vascular zone. Well, we may not choose to expose them to fluorescein angiography, but I think OCT is very much helpful in diagnosing this condition, as you can see. And also you'll notice that vessels are very much, just like in that ROP case, pointing down, diving deep into that vascular complex. The significance of this is unknown, but it's interesting to see. We very much think of foveal of familial exudative vitreoretinopathy or fever as a peripheral vascular disease. Well, I'm here to tell you that it is not. It's also very much a macular disease. Well, you'll notice in this deep vascular complex, we see a loss of capillaries and really barren capillaries with these really kind of nuggets or bulbs, as we are calling it. And it does seem to correlate with progression of the disease or severity more so of the disease itself. We have used this very much in CNV and pediatric patients. As we all know, just like it's difficult to examine, it's even more difficult to do a fluorescein angiography in pediatric patient in clinic. But 5-year-old, even 6-year-old and older for sure will very much tolerate an OCTA with a tabletop system. So here you'll notice classic signs of FA, findings with occult CNVM, but you'll notice that OCTA shows that very well pre and post treatment, where we have loss of these fine capillaries, and we very much see that a treatment was adequate. In Coats disease, we have used as a way of potentially monitoring a fibrovascular nodule formation, which over time can become vascularized. And there's a question whether a role of anti-VEGF therapy may be beneficial in this disease. I think that question is to be found out yet, but very much OCT is helping us diagnose this. So we talked about really imaging with some of the conditions with tabletop system, with a portable system that we can take to the operating room. But how about imaging babies in the NICU or even those infants that end up in our clinic? Those are unlikely to really end up under exam anesthesia. Well, we partnered up with a biomedical engineering team to develop a handheld portable OCTA. This is our prototype unit. It's a lightweight. It's much lighter than the current system that's available, but even much faster. You'll notice on the left side, we really can capture an image in less than a second. And here are some of the images that you can see from that. You'll notice that we see typically a macular edema in premature infants. We can also see NFOS images of vascular front development, as you can see in the middle row with that yellow arrow. And then really in the lower images, you'll notice a vascular front or actually really more of a ridge development that we can see with this system. We can also obtain OCTA and capture in less than 6 seconds and really develop and follow a development of foveal vascular zone. Here's really work done by my colleague Shi Chen, who is very much studying these premature infants and following the foveal vascular zone development. You'll notice this 33-week infant initially did not have it, and by 37 weeks very much have a developed foveal vascular zone. So in conclusion, portable optical coherence tomography is a great new technology for evaluating retinal diseases in infants and children. We are able to capture early retinal capillary vascular flow in the developing perifoveal vasculature and differentiate retinal vascular diseases that we were not able to do before. And we believe that this will provide us insights in retinal neurovascular development and may even serve as screening tools for pediatric patients in clinic for various diseases. I really want to acknowledge my entire team. Many of them are really illustrated here, but some of them have not really quite made the slide. An acknowledgement particularly to Duke Pediatric Retina and Optic Nerve Center, amazing group of women who really take care of these infants and children, as well as our biomedical engineering team for really coming up with tools that we can treat these patients. Thank you so much.
Thank you, Leila, for that wonderful talk.